Welcome back. I'm your pharmacist today and I'm going to explain to you what is hypertension. Normally, our bodies have regulatory mechanisms to regulate blood pressure at a constant range. However, if our blood pressure measures consistently above normal, this may result in a diagnosis of high blood pressure or hypertension. According to the American Health Association, normal blood pressure values should be less than 120 mm of mercury systolic, which is the blood pressure exerted against your artery when heart beats, and 80 mm of mercury diastolic, which is the blood pressure exerted against artery walls while the heart is resting. Any values higher than 120 mm of mercury systolic or 80 mm of mercury diastolic should be considered as abnormal, especially when it reaches 130/180ths of a millimeter of mercury. Any individual that has a higher blood pressure than 131 mm of mercury is considered as having hypertension. Hypertension presents no symptoms in most patients. Some common complaints from patients include headaches, tiredness, dizziness, shortness of breath, and nosebleed, which are commonly overlooked by patients and underdiagnosed. Beware, hypertension may lead to heart attack and aneurysms due to the damage of high blood pressure to the blood vessels. Remember to check your blood pressure regularly to prevent these problems. So, what causes hypertension? Hypertension can be divided into two types, each with different cause. First type is primary or essential hypertension, which accounts for about 95% cases of hypertension. The cause is largely unknown, but the risk factors include obesity, insulin resistance, such as in case of diabetes, excessive intake of alcohol and salt, low intake of potassium and calcium, aging, and a stressful and sedentary lifestyle. The secondary type of hypertension is directly caused by underlying conditions such as obstructive sleep apnea, kidney diseases, thyroid disease, and congenital defects of blood vessels, or medications that work to increase blood pressure, such as birth control pills, pain relievers, and illegal stimulant drugs such as cocaine and amphetamines. Sphygmomanometer, also known as a blood pressure monitor, or blood pressure gauge, is a device used to measure blood pressure. Now let us proceed to pharmacological management of hypertension. Antihypertensive agent is helped in reduction of blood pressure to acceptance range. These are the antihypertensive agent that commonly given by doctor to patient, which are ROS inhibitor, which include ACE inhibitor and ARB inhibitor, diuretics, beta blocker, and calcium channel blocker. Non-pharmacological management of hypertension. According to research conducted by Ohio State University, non-pharmacological management for hypertension are reviewed in rank. Rank A is the management that is consistent, provided with good patient-oriented evidence. It emphasizes on diet modification by practice low-fat intake, low sweets intake, engage in moderate to vigorous aerobic exercise, non-smoking. Rank B is the management that is inconsistent or limited quality patient-oriented evidence. At this phase it emphasizes on reduced sodium intake to 2,400 mg or 1 teaspoon per day. Rank C is management only referred to specific case or condition related to hypertension. At this phase, it limits alcohol consumptions. For women limited to 1 drink per day, however for men 2 drinks per day.